All right, so I am recording this meeting for the mamas that are right in the middle of maybe bedtime routine or some stuff that's coming up. So if you're watching this in the future, welcome. I'm Christina. I am a pregnancy and postpartum life coach, and my mission is truly just to help women have the best possible experience when it comes to pregnancy, childbirth, and that early parenthood stage, because it is a lot. So my goal is truly just to help you overcome all the frustrations that you may be experiencing with ease. And so that includes me bringing incredible healers into your space for support. So I want to introduce you guys to Brooke Miller and Ruth Ann Savannah. They are two incredible physical therapists who specialize in this prenatal physical therapy and postpartum recovery journey. So I'm really excited for them to be here to support you guys through that experience. And I wanted to remind you guys at the end, we'll have Q&A as well. So lean in, feel free to ask questions. So without further ado, I'm going to hand it off to Brooke and Ruth Ann, and I'd love for you guys just to introduce yourself and tell us a little bit about yourself.
Yeah, absolutely. So we're super happy to be here. We love doing stuff like this. We find that with the things that we're going to talk about a little bit, so much of the time it's things we've never heard of, or I feel like a lot of women kind of live in the dark a little bit about. And we were talking just right before we started, and that, you know, and we'll get into it, but our advice is always like advocating for yourselves, and that we feel like most of this information isn't given. It has to be like sought out. And so doing things like this is our very favorite, because it allows us to truly just talk with you guys and to share our experiences, and then how we, you know, the things that we see in our clients and in our patients. So we're super pumped to be here. So we're happy to be here. So we both are physical therapists, but we both work at a clinic in Louisville called PeakRX Physical Therapy. I opened it 4 years ago, and it was really opened, and I started it out of a need. And that I always tell people, I decided that I wanted to be the clinician that I wish I had had for myself, that I didn't. And what I mean by that was was a regular physical therapist, you know, treated pain and joints and all of that. But then I got pregnant, and with my son, who he's now 5, and had a pretty normal pregnancy. I do CrossFit, so it was just, you know, active and sort of an athlete, not really good at it, but no one could guide me in it. You know, I asked my midwife questions, and it was things like, well, just do what you've always done. And I was like, well, I'm like climbing ropes and jumping on boxes, and that didn't make sense to me. And then she was like, well, just listen to your body. And I was like, well, you know, as an athlete, you're used to kind of like not listening to your body and like pushing through. And I didn't like those answers. And then it was like, well, don't lift over 20 pounds. And I was like, well, that doesn't make sense either. So we have all these very ambiguous guidance in pregnancy. And then postpartum, after I delivered my son, being very honest with you guys, my husband and I could not have intercourse because it hurt so bad, like unable to for months. I went back to my midwife and was like, we have a problem. And I was told to just drink wine, and like, it was my problem. Like, I needed to relax. And anyways, I immediately like quit my job, got certified in this, knowing that there's this whole side of things for moms, and that, you know, we're given one appointment with our OBs normally after we have babies, and we had a huge major injury to our bodies. So all that to say, that is what we do. We both are pelvic health specialists, and that we specialize in the pelvic floor, which is a muscle group inside of us, and it's our vaginas. It's all poop, pee, sex, all the things that are very important to us, but we just don't really like talking about. And so that's what PeakRX is, and we want to bring that to you guys. We help women through the lifespan, in that pregnancy and postpartum is a big trigger for things, as well as menopause. And so we want to kind of help women walk through these stages of life, and know that there are people out there that can help them, and that they don't have to live with peeing in their pants when they sneeze, or when they run, or pain with sex, or whatever. So that's what we do. And we like to make it fun and about kind of the things that you want to do too, knowing that things like Camp Gladiator or CrossFit or jumping on a trampoline are all still very fair game, even though we've had babies.
I love it.
Yes.
Yeah. That's just like I remember when I first met you too, just hearing about your journey, myself being in that 4th trimester and being like, I don't know how to recover. It's so true. Like showing up, like it's like the answer is you're right. Like you really have to like figure it out or dig, like just do all this research. And there's a lot of times really contradictory stuff. So that's why it felt really good when me and you first started talking, where I was like, could you just like, I just need someone to tell me what to do, especially having just had a C-section, which I did not plan for at all. I was like, I'm scared, like to stretch, to do like, am I gonna rip something? You know, like I don't know what's going on with my body.
Yeah.
And so there was so much like peace and calm to the fact that you guys are just dishing it up in a way that's like very easy to understand. It's very paced in a slow way that is so important for recovery, but it still feels like, a challenge enough where I'm like, okay, like I feel like I'm really doing something and pushing the needle. So yeah, I really commend you guys for making it really easy for women to prepare for pregnancy, labor and delivery, and then recovery, because that part is the part I just didn't even think about.
Sure. Yeah. That's awesome. And you kind of said it really well in that I feel like a lot of the times we run into people will prepare. They'll prepare for what they want, right? They'll prepare for a vaginal birth, but then what happens when you have an unplanned C-section? It's like, boom, like your world explodes. And then again, you're told, hey, don't lift more than 10 pounds for however long. And it's like, you have, maybe 2 or 3 kids at home,
Yes.
or you're a single mom, or you have to go back to work, and those things just aren't doable, and no other guidance is given. And so that's really what we run into is everybody's journey is so different. Their goals are different, and their home life is different. And that even to give a blanket program to somebody doesn't even make sense. And so that's really what it is just kind of meeting people where they're at and being able to kind of, like you said, dish it up in a way that's digestible and not overwhelming, but that still gets them where they want to go.
Yes, 100%. Because let's be honest, that 4th trimester is so overwhelming that it's like the fact that you guys make it really easy was my favorite part about moving through the program, because it was just very straightforward. You had videos. It was just like, okay, I need to do this today, or if I can't get to it, awesome, I'll do it tomorrow. I'll try again the next day. Yeah.
That's good to know. That makes us happy.
Yeah.
Good. So when I'm thinking about, so let's say a woman who's currently pregnant and she is trying to figure out like, what does a healthy and safe pregnancy look like? How can she prepare for pregnancy and also labor and delivery? Are there any tangible steps or recommendations that you might have for someone? This is kind of generically, because you're right, there isn't a blanket fix or blanket recommendation, but overall from the women that you've seen, are there any recommendations you guys have for someone who's currently pregnant and preparing for what she thinks will most likely be a probably vaginal delivery?
Yeah, so I think that, for me personally, I haven't had kids yet. And so me approaching this whole world is a little bit different, but I think this is where I get to really speak into, like, this is me looking at myself of like, when I start having kids, of like the things that I want to have, knowing what I know now. And I think our number one thing that we talk about a lot of times is you've got to building your team, and building a team of people that you trust and that are going to guide you in the direction that you want to go and help you make those decisions. And so whether it's like your OB, interviewing OBs, having people that you're comfortable with. Obviously, we're going to plug some of the stuff that PeakRX does, but what we're here to do is help you in that prepping for physically, from like a physical standpoint, going through your trimesters, knowing what's going to be good for you, what's going to be something we need to hold off for right now, based on not only where you're at in your pregnancy, but also just in how you move and are as a person. And so having people like that, or even we know trainers that work a lot with pregnant women. And when you're looking at all those resources, just having those conversations of, okay, do you have experience working with pregnant women? Do you have any type of certifications there? Like having people that have done this before, or at least have enough knowledge to know like when to ask questions or when to refer out. So it's just a lot of you having to kind of guide your own path and collecting your team, but you have a lot more control there than I think we realize. We think we get pregnant. I've had friends that are pregnant now and get pregnant and just go to an OB because they're pregnant now, and this hasn't really been on their mind. But in my mind, it's like, no, you need to find somebody that's going to help you, like, as you kind of digest what's happening, that you're pregnant and you're creating these plans of what you would like to have happen when you have the baby. You having people that are going to support that and help you like walk through that, or present options to you as you're kind of learning this new space, I think is really important. Even like chiropractors who are certified and, you know, Webster certified, and these people that are very experienced with this type of just journey, I think is really important. And you collecting that dream team, if you will, to kind of, because it's centric, it should be centered on what you want in that experience. And so that's one of our really big things for people that are pregnant now and are looking into that, whether you've been pregnant before or this is your first time around.
Because if you think about it, I just, based off your question, like when you say what makes a healthy pregnancy, like the word healthy, what does that even mean? Like that truly means something different. Like if somebody who's very normally high stress or deals with mental health, it's like, okay, you need to make sure that that's something that you're managing. Now, obviously we're the physical realm and we're big on, yes, we know now that exercise is very important in pregnancy to help decrease the risk of lots of things. And so again, finding, if you're a CrossFitter, find a CrossFit coach that knows pregnant people, or a PT that knows your sport, or whatever that is. And so that's, I think, how you blanket it is, again, just making it be like, what are my goals? What would make me a healthier person? And then find somebody who knows it and listen to them.
Yes. That is such a good piece of advice. And to just follow your intuition too, like when you're leaning into like the people that feel really good as you're building your team. I feel like that's such a good point too, because even like my OB, I kind of got like the impression that he was like just really like, let's get shit done. Like, and so I felt like I didn't have time to ask questions, but I also was like, is it too late in my pregnancy to like find another doctor and all this stuff? And then it's like, you know, as I'm like pushing, he's like taking a phone call and I'm like, what the fuck? So like certain things where it's like, okay, like follow your intuition. Had I followed my intuition, I potentially would have been with someone else who was delivering my baby. But I think that's a really good point, is just to follow your intuition, lean into healers in your area that feel really good based on your goals.
Yeah.
Because right, it is holistic. It's like find that chiropractor that has that Webster certification, where it's like they know how to move your body in a way that it like opens your pelvis, and you know, that's at least what my chiro was telling me. So yeah, I think that's a really good piece of advice.
Yeah. Awesome.
Cool. So what about for the woman that is in her 4th trimester? So she has just had a baby, potentially either vaginally, C-section. What would you recommend for her when it comes to next steps?
So ideally, we've already met her and she's already on our schedule and we worked with her before she had her baby. But if not, our big thing is that 4th trimester is very, the current state of the union is very old world. You know, even the 6-week release, that truly doesn't mean anything to us and shouldn't really mean anything to you either. And that we're very big on 6 weeks is way too early to start normal exercise. Like, so to be just released to go on a run or to go back to the gym, way too early. But it is also way too late to start recovery. And that you are somebody who was a part of our program, you came in a little bit after. But if you start with us when you're pregnant, you literally let us know that you had a baby and I give you like 24 hours off and then you start your recovery. Now, it's not crazy exercises, but there are lots of little bits that you get to do. And then every single day is a build from the last, right? So we always tell people your recovery after baby should be like a linear, every day, maybe a little bit more than the day before. And that is how you gain strength. That's how the tissues that have been stretched out for 10 months get to slowly rebuild. And you're just, you know, gradually giving yourself a load. So we're huge on that, right? Of please, like find, and it's a physical therapist. That's what I'm going to tell you to do is please, every single woman who shoves a baby out of their vagina or it is cut out of your belly, please go and see a physical therapist. You had a major injury to one of the muscles in your abdomen and your core. And that's who is going to allow you to give you those little things that will help you to kind of rehab and to recover, right? So we're very, very big on obviously finding a professional help guide. I think that is very, very hard to do on your own. And a lot of the times it's like genetics and luck is why people do okay without. But we also have a lot of data, or no, we have zero data on why we have a lot of issues later in life. And we're very big on, we think it starts with pregnancy.
Sorry.
It's okay. Sorry. I'm like, is that me? You know, we have these huge injuries and we go through life. And with that, we always kind of say they're like thieves in the night a little bit. Like we don't realize that we have problems until we're 60 and we have now prolapse, or we are totally peeing on ourselves or whatever. And we truly, when we see these 60-year-old women come in to see us, their bellies and their pelvic floors look like they just had a baby. And we, you know, the more we dig and dive into it, they're like, oh, I had no idea. And you know, most likely they've been doing all these kind of things since they had their baby. So all that to say, go see a PT. We also are just big on, there's also a lot of really good programs out there that are a little bit more blankety, if you will, that I think are good. And I think that if you are somebody who cannot get in to see a physical therapist for whatever reason, those programs are still totally worth it. They normally aren't custom to you, but that can be okay. And that kind of guides you through kind of core rehab, if you will, as opposed to doing nothing and then doing everything at 6 or 12 weeks or whatever. So finding that guidance and then just being patient. We tell all of our moms that come in, I mean, if you think about how long you were pregnant, you got to kind of remember that when you're wishing your belly was flatter, or you were wishing you were back to running or jumping, and that you had a huge big fat baby in your belly for 10 months and then pushed them out of your vagina. Like it's going to be at least that before I feel like you are kind of back to normal. And that would be a very normal, uncomplicated person. So just being patient, not giving in to the anxiety or to that like, I got to get back quick, right? And that this isn't, and you will be so glad that you were patient with it, you know, later in life, really. So those are really kind of the big points that we talk with when we have somebody in our office with us.
Yes, so true. That idea of having grace with yourself as you're moving through, because I know specifically I reached out to Ruth Ann and I was like, I feel like nothing is happening. My stomach isn't flat. I'm pissing my pants. Like, what's happening with my body? I hate this. She's like, hey, you're literally like 6 weeks postpartum. Like, have grace with yourself. Like, you're doing a fabulous job. Like, just give yourself a little bit more time. And the fact that you're showing up for yourself, you still feel challenged through the exercises, that tells me you don't need something further. So I felt like that was a really good piece of advice where it's like, if it was really easy for me, then yeah, let's dive into something that's harder, you know, that's will challenge me. But the idea that I was still feeling challenged by the exercises I was doing at the time, but not seeing the results, it's because the results are more internal. But like when I was moving through it, it's like, that's kind of how it felt, where it wasn't like immediately overnight. And I think that was the Aries in me that was like, let's do it now, yesterday, you know? And so I just needed like a moment to just be like, you're doing great, like calm down. That's also why it's really helpful to have these people in your corner, like you guys. It's just people who understand what it's like to go through the process and to really remind you, like, don't give up. That's kind of why self-guided programs are awesome. But when you hit the wall, what I really appreciated was being able to just chat you guys and be like, SOS, I hate this. Yeah, exactly. Send help.
Yeah, it's so true. Yeah, that's awesome. That's good to know. Again, it's all very, I think you said it really well of like, to understanding that this is a season where your limiters aren't like, a lot of times it's not even pain, right? It's things, the things that are limiting us are, again, we're not used to it. It's peeing in our pants, which is normally kind of new to us, but we don't realize like that's a sign that I am doing something that I'm not ready for. This isn't something to laugh about. This is not a badge of honor. And this is not at all what I deserve because I chose to get pregnant. And that we have these new like whispers, or what we call as like yellow flags, that we're just not used to. And it's not innate or intuitive either to know like, hey, there are some things that tell me I'm not ready to do this yet. And I think that's our big thing is if we can educate you on these kind of new things, or this new, your next normal, or if you will, then you can self-pace and guide yourself so much easier. And then I think it's less daunting and less, I don't know, overwhelming, because it's understandable at that point. And there's some timelines with it. If it's like, it doesn't matter who you are or how great you are, there are things that time can only heal. So I think when you can kind of put those pieces together, it's just, the heat's off of you, or the weight is off of you. Like, okay, that makes sense. I can't really rush this right now. I need to be patient and just one foot in front of the other.
Yeah.
Yes.
Well, I think another thing too that, just to kind of speak to that, even like with our conversation of you feeling like, well, my belly's not flat yet, like I'm not where I want to be here. But the thing about what we get to do with our programming is we don't only focus on those things. Like we don't only focus on what your belly, we talk about that, but there's so much more on the table for us to work on that can be almost like pelvic floor and core neutral. I'm going to have you do calf raises, because if you want to get back to running, you've got to have that strength back. And so we have to earn that ability to go back to those things. But the beauty of that is, okay, I'm hitting this wall with my core stuff, or it is what it is right now. I just need to continue to practice that and let time happen. But in the meantime, I'm going to go like work the crap out of my hips and my legs or my upper body, or find these other like pivots, if you will, so that we don't continue to hit that wall. So if we look at the same thing over and over again, it just becomes this very like mental beat down. But then we get to pivot. Like when we got to talk, it was like, well, your workout's so hard. Well, yeah, they're still challenging. Great. Like that's awesome. You'll keep working on your workouts. Like let's focus on some of those things where when we get really like blinded, or we have like our blinders on and what we want to get out of that time, but then having these other things are just almost like an encouraging piece of like, okay, great, I'm gonna like put this to the side for a second, I'm gonna keep working on it, but let me hone in on like getting my calf raises good, or something random, but we still feel like we're moving forward.
Yes.
So that's been like a conversation I feel like I've had like very frequently and often this week for some reason, but it's just, we've got these multiple targets. That's so that we don't feel like we're hitting that stopping block every single time.
Yep. Yeah. And I feel like you brought up a really good point around that as well. When we met earlier this week, when you were talking about where it's like, we don't just target the one area. Like I'm not going to have you sit here and do crunches. I'm going to have you really focus on like your legs too, like the outside of your legs. So you're not putting pressure on your pelvic floor. Like how can we take some of the pressure off your pelvic floor and off of me? I have plantar fasciitis. So how can we strengthen other parts of the body so that we're not putting all of the pressure, the weight, whatever it is, on these areas that without having built up the strength in those other areas could potentially have issues. Mm-hmm. So I felt like that was really important to hear too, like this holistic approach of like, just because I want a flat stomach doesn't mean I just focus on core. Like I need to be doing a lot of different things so that I feel strong in the front, back, legs, everything, where it's really a holistic approach, because your body is, when you're carrying a child, it is the whole body that's doing it. Yeah. Not just the uterus. I mean, your whole body is working towards this baby. So yeah. Sure. Yeah. So tell me a little bit about the difference between recovery when it comes to a vaginal delivery versus a C-section.
Great question. We get that a lot. Yeah. So, I mean, I think that when we think about like C-section and vaginal delivery, first things is like, most of the time when it comes around, like when it comes to like delivery itself, we get so like, we plan for it. We want it to be a very specific way, and then our plan doesn't happen. And so we kind of get bogged down by it. So really what you think about it is like taking that question, well, yes, there's considerations there, but it's really the middle where that's different, and the ends are very similar. So like the beginning, we're still growing a baby. Our body is responding in a very specific way. So we have to rehab that part. The middle part, if we kind of break it up into thirds, if you will, is more of that, okay, we're going to be a little bit more like centric towards you having gone through a C-section versus a vaginal delivery. But then that last third is pretty much you end up in the same bucket. And so there are a lot of similarities, but in that middle, there's that difference. We think that, oh, well, I had a C-section, I'm not going to have any vaginal issues, or I had it vaginally, so I'm not having any core issues. But that our core is a system that works as a unit. And if we have an injury or something that happens to any part of that system, things can get off kilter. So people who have had a C-section can still have vaginal, like, or, pelvic floor issues, and vice versa. And so We just kind of have to tailor that middle part more towards, okay, what did happen in your delivery? And let's talk about that. There's going to be some considerations there.
Yeah. I think she's exactly right in that most of the time, there's very little on our end of what we give to you guys that is different. Now, the things that are very, very different are obviously you're rehabbing from an incision on the front of your belly versus not. And so there we're going to go down a lot of roads on like scar management or massage or incisional work. That's something that we feel like most cesarean sections are kind of overlooked, is making sure that all those layers of tissue are nice and compliant and move really well. So I think that's very C-section specific. We are also going to talk, when we talk about managing pressure a lot, and that when we look at our bellies and our core of, we always say when you, if I had a balloon and I squeezed on the top, that pressure is always going to go path of least resistance. And so a cesarean birth, your path of least resistance is now going to be at the front, while a vaginal birth, your path of least resistance is going to be straight down. And so we do, and this is very generic. This isn't set in stone, but most cesarean deliveries do end up with a lot of pain, pelvic floor tension and pain. So a lot of pain with sex is very common with cesarean deliveries, as well as stress urinary incontinence or leaking urine, but due to a pelvic floor being too tight. While vaginal births are going to be kind of in that opposite camp of we're a lot of times we're looking at more strength-based things for their pelvic floor, and more of like a coordination issue. So we might come at it a little bit differently, but really it's all kind of the same. So I hope that's a very ambiguous way to answer your question.
Perfect. No, that does help though, because originally when I was coming in, I was like, I feel like my recovery is going to be so different having it be a C-section that like I didn't even know where to start, because I had fully prepared on like, this is a vaginal recovery, and so that was where all my research had gone. And then, but to know that too, that's actually really helpful to say, okay, the research you did is helpful, yes. And there was that idea too of like, think about scar mobilization, like think about the massaging of the area when it is the right time. Like things like that where you're like, my OB didn't tell me any of that. Like at 6 weeks, he's like, you're good to go, like do whatever you want. And I'm like, okay,
Cool.
Wait. I have so many questions, but yeah, it was like, he wasn't the best research for that. So I think to y'all's point, it's like, find people who you feel like you can ask questions to that will give you answers that will actually support you in your own recovery, because it is an individual journey.
And in their defense, OBs and midwives, like that's not their expertise. Like they don't know the names of the muscles of the pelvic floor. Like they are there to deliver your baby and to make sure that you are alive and your baby is alive. And that's what they do. And hopefully they do that well. The problem, and where we have beef with some, is like, we think every single woman needs to be referred for at least one postpartum screen to a physical therapist. Just, do you have DR? Do you have pelvic organ prolapse? Like, what is the state of the union with my body so I can make good, healthy choices in the days to come? Like, that's bare minimum. And you have some OBs who are very good advocates for PT and know that they don't know those answers, and that we do. Like, we are the musculoskeletal experts. But again, you don't know, like so many people don't even know that pelvic floor therapy exists, so they don't know to go get that referral themselves, if that makes sense. So that's the beef. While in Europe, like Sweden, every single woman that's a part of their care, is they have a baby and then they go to pelvic floor physical therapy. Like, it's standard care. So we just kind of have this big, gap in care, really. And so it's like, tell all your friends, like tell your people, like go see a pelvic floor therapist. Like, that's how the word gets out, right?
Yeah.
So that's really where we're at.
Yeah. Let's be more like Sweden.
Yeah, that would be awesome, right?
On that road to creating that for us. I'm so grateful. Let's see. So if you guys could provide us with any words of advice specifically for moms or moms to be, what would it be?
I think we've all kind of said it. It's really kind of be your own advocate a little bit, which I hate that of like, oh, do all the work yourself, but it's like, don't always take everybody for their word, right? Like, so if you're like, hey, what kind of exercise can I do? And you're midwife said, or your OB or whoever says, oh, don't let your heart rate get over 140, but do anything else that you want. And it's like, you feel weird about that, or your goals are more than that. I'm not saying she's wrong, but it's like, just go and ask, like, is there somebody else who may know a little bit more for me? Or can I find like a postpartum life coach, right? Like we've got all these niches. We have hypnobirthing, we have Bradley method courses, we've got acupuncturists, we've got all these people, these healers, like you've said. And it's like, you've just got to find the people that, like, I think speak to you in your heart and what's going to help you. And that you can't do all of it. But you can find the ones that I think make sense for you and your personality. So it's like, I always say too, like, find somebody in your circle who has maybe had kids before you and ask them, like, well, what did you do? You know, what's your advice, right? Of just, you got to kind of get all the information, you got to gather it, and then you can kind of sift through it of what makes the most sense for you. And that there's no right or wrong. And, you know, like, you can't plan for birth.
Right.
It's not going to be, I always say, plan for, you know, plan A, but you need to have a B, a C, a D, and an E available, and know that maybe D or E will happen. Like, that's how you have to go into it. And so I just think the more information that you have, the better. And then from our side of things, we offer what's called the PeakRX program, which is a wellness course or a wellness program for women who want to prep and to recover well when it comes to their tissues, pelvic floor and core. And so if you're somebody who's an athlete, like, if you want to at all be athletic after baby, you have to do our program. Like, you have to.
It's true.
And it's like, okay, let us help you on that side, right? So you don't have to guess on that, right? And so that's our advice, is just find the people who know it to help guide you. And that we think that there's so much gray area that most of the time when we see people postpartum, like, they haven't seen us before, they all are like, oh my gosh, why didn't I know this before? Or they're on their third baby and they're like, why didn't I know this before? And so our big mantra, or a part of our, like, mission is like, we want to take that out, like, that I wish I knew, like, we want to debunk that, or to take that out of people's vocabulary, and that we want every woman to know. And then you can make those choices yourself, because you have the education and the information to advocate for yourself and for your body and for your baby.
Yes.
I think we talk a lot about, like, you know, I think I wrote like a blog or something, but it was like, think about menopause. Like, these are all like phases in life that women go through, like, not letting menopause happen to you. You're not just going to sit here and hope for the best on the other end. Like, there are things you can do to actively make decisions so that you can be in a better spot once you get to that point. And, like, pregnancy is such is another area of that. Like, I can't believe how many people I've talked to, and I'm like, hey, what's your birth plan? Like, some of my friends, what's your birth plan? Well, I don't know yet. Great. You need to figure it out. Like, don't just show up to the hospital and hope that everybody's going to want the best for you, because while that may kind of be true, you've got to make that known, and kind of, like, to the point of, you know, being your own advocate. And like, don't be afraid to gather information, because there is information to gather. And I think that that's where some of the misconception comes on. Well, they'll just tell me what I need to do. Like, there's some of that where you need to generate your own opinions of that, and know that there are opinions to be generated there, because there's so many different routes you can go down, but you've got to do what's good with your, like, what's going to help you sleep at night, knowing you put your best foot forward, you did all the things you could do. So if something does happen where, you know, plan F or E happens, you feel good about all the steps that happened there up until that point. And you're like, well, you know, this is an unpredictable time, but I've done everything that I can to feel good about that. I think is just huge. And it's just, if we could, like, get on our soapbox and get every woman to be opinionated about these things and, like, advocate for themselves, it's very much like, we could talk about it for, like, literally hours, but that's just our big thing, I think, is just having that and not being afraid to search for those answers.
Yes. Yeah. So well put. To plan ahead too, because that, I think there is, like, this, like, almost when you don't plan ahead and something happens, it's almost like I feel like I had a little bit of PTSD from having a C-section. I'm like, I was not mentally prepared to have a major surgery. Like, I just wasn't there, you know? And I think that's where I kind of was like, okay, Google, like, what do I do now? So to be able to plan ahead of time, I think I would have felt a lot more prepared, a lot more calm when it came to the actual C-section part. I think, you know, it was like, okay, this is the best option, let's do it. But afterwards I was like, what just happened? And so it was that idea of like really like leaning into people who make it easy for you too. Like people who you're like, I trust you, I feel good about you intuitively, I know that you have my best interest at heart. I also have my opinions, which I'm going to bring to the table, and we can, this is a co-creation of what healing looks like. But the idea of like, make it easy for me, that's why we go to these healers, these people, is that they make it easier for you, because there's so many other things you're doing when you're a new mom or a mom of 2 or 3 or whatever it might be, where you're like, I don't have time to do all the research myself. So can someone just tell me what to do?
Yeah.
So finding people who can literally say, this is what I recommend, and if it feels good, then all you have to do is do it.
Yep, that's exactly right. Yeah, that's awesome.
You guys are amazing. Thank you so much. So Michelle, Danielle, I know you guys are on here. Do you guys have any questions about your recovery right now, specific to anything you're experiencing?
Do I? Oh, I do. You guys can hear me, right?
Yeah.
Okay. Sorry if I sound like I'm shouting. I've made earbuds and it's the first time I'm using them with noise cancellation, so I can't hear myself talk. So it's really loud. I'm so sorry.
Shouting. You're not shouting. You're good.
Okay, good. Okay, so one of the questions I have 2 major questions. One is, okay, so I am 40 years old. This is my first pregnancy. And I'm in the 6-month mark as we speak, about 27 weeks now. Is recovery going to be a lot harder for me at my age compared to, someone who's like in their 20s or 30s?
That's a really good question. I think that it is that, age is like a very small line item when you do look at recovery. But no, I have not run into that. I don't think that that's a big predictor. I think that you are really, and honestly, the thing that I feel like is the biggest issue with people is subsequent pregnancies. So it's truly your tissues change. So you have a win and that this is your first pregnancy, and that I feel like there's nothing, short of, I don't know anything about you, I don't know your history or anything like that, but that, no, I wouldn't be looking at that as a reason of it being potentially harder or different or difficult when it comes to tissue healing.
Okay. That's good to hear. Because then my other question is, I know you guys talked a lot about, the pelvic floor and like scar management and tissue and everything. But one thing, so I do go to a prenatal chiropractor right now. And one thing that, I've been really struggling with and making sure I've been trying to do is, with everything with the ab separation and, with her telling me, okay, roll on your side before getting up. And sometimes I forget. And then I get like really scared that I'm like destroying my abs and all that. So do you guys, work with recovery with that as well? And is that really hard to get back?
So first off, every single pregnant woman has DR. Like our abs have to split because we have big babies in our bellies, and that's the only way for them to fit. So first of all, everybody has that, right? Now, when you're looking at truly being diagnosed with, we call it diastasis recti is like the name of it. So DR is what we call it just because that's hard to say. But when we're looking at you being postpartum and dealing with it, first off, I will check that on a mom's belly if they come to see us early, but I don't speak to it until normally about 12 weeks postpartum, and that we all have it. It takes a little bit of time for it to come back in. Our big thing is yes, there are choices that you can make during pregnancy, labor and delivery specific, and then postpartum to help mitigate the risk of you potentially having it or a big case of it, or however you want to say it, right? But more than anything, or our beef that we have is exactly kind of your question is most of the time people come in scared to death of it. You're not going to explode if you accidentally forget to roll to your side and get up. It isn't one time that is going to give it to you. Most of the time, your issue is genetics. Even if you did everything right, it's just your mom and your dad and the genes that they gave you. That's why you end up with DR afterwards, is number one. It's how you also carry your baby. So much of the reason why women have it is completely uncontrollable. So that's the biggest thing.
Okay.
Second is, yes, there are a lot of things that we can do from a musculoskeletal standpoint, and that we're very big on during pregnancy is working on your core, but doing it in a way that is very different than what you're used to. So we're big on, you're no longer doing crunches or planks or, kind of your traditional core work, and that women that do continue to do those things are at a greater risk for DR. But we kind of swing it, and that there are things that you can do now to help mitigate your risk. And then, it was exactly what we talked about when that 4th trimester is immediately after. If that's something that you're truly worried about or that you're concerned about, then even more reason I want to get with you day one. There are things that you can do that will help you to go ahead and start healing that, or not getting it later, or whatever, however you want to look at it. There's absolutely things that you can do. But number one, don't be scared of it. That's
Okay.
the biggest thing, is do not be scared of it. Because I promise you, if you end up having it, it wasn't your fault.
Okay.
It's what it is, right? There's so much fear around it. It's a hard one to kind of get, because if you Google it, it's like, gosh, just don't Google it either.
Okay, good to know. Yeah, because I'm all belly. So, and that's what scares me the most, is that it's all belly. And
yeah.
And I'm just like, oh my gosh, like, is this thing gonna really deflate afterwards? Like, what's gonna happen?
It does seem a little crazy, and you're like, I can't get any bigger than this right now. No, I think, again, my advice is, if you're truly worried about it now, go get somebody to help you now, because there is some preemptive things we're big on. If you think about you being all belly, going straight out, it's like, okay, well, what does your ribs look like? What does your spine look like? Like, there is some kind of mobility and exercises that can be considered preemptive, or what's the word? Preventative. Thank you. There are some things, there's not a lot of research about it. So it's like, again, if that's something that's not really up your alley right now, or not doable right now, don't worry about it. But there is some things that you can kind of start doing. And our big thing is like, again, educating you on it, for you to know, like, do I have it or do I not? That everyone comes in like, I have DR, I know it. And then I look and I'm like, oh, you don't at all. Like, I'm just debunking myths around it is normally the best thing that I can do for somebody.
That's awesome to hear. Thank you. Yeah. And then I guess, just overall, and I'm sorry, Michelle, if you have questions, I'm almost done. The sad thing is, I did stop working out. Basically, like, I was going on and off working out pre-pregnancy. I was doing Camp Gladiator, and I've been doing it for about 5 years now. And work between COVID and like just the pandemic in general, and my work hours, like, I just kind of got very sedentary. Then I got pregnant, and then I tried going back to working out. And I know you guys had mentioned, like, in the doctor says, like, don't get your heart rate over 140. 160 is okay if it's for like 10 seconds, but make sure you like drop down really fast, and don't lift the heavy weights, like, all of that. So I stopped running, because my heart rate, like, I've always had a heart rate that it goes up really high, but it drops really quickly. Like, I just was very healthy, and I got really scared. So I honestly, like, I'll go to Camp Gladiator maybe once in a while, but I don't use weights anymore. I use the rubber bands, and I don't run, like, at all. Well, obviously I can't run anymore. I have like a bowling ball in my stomach right now. So, but so I'll go like maybe once a week or once every 2 weeks. I try to go for walks as much as I can. I think this past weekend, like, we went for a hike. We actually went for 2 hikes, which was really therapeutic and just very nice to do and get out there. But again, I don't feel like that's enough for me, because I had my first, I read this online. It's called a sneeze pee. And and I had my first one on the hike, and I was like, oh my God, that was embarrassing. And you have to finish a hike like sweaty, like with pee in your pants, and you're like nowhere to go. And so it's just, I am, and I'm like trying to do Kegels and all that stuff, but I don't know if it's enough.
Yeah, I think I have a couple thoughts on that. First off, when you're looking at like what's enough, what's not, I want to first just kind of maybe give you a little bit of some relief or some clarity in that when we're looking at exercise, there are some women who cannot exercise because of complicated pregnancies or they're on bed rest or whatever. So, and I'll be honest, I just had my third baby a few weeks ago and I worked out like twice the entire pregnancy. Like, see, I'm an athlete. Like I was embarrassed, but I was like, I don't even care. And I'm fine. My baby's fine, whatever. Like, it's okay. Give yourself grace in that, right? But when we look at the benefits of exercise, there's a lot of good that comes from it. The decreased risk of gestational diabetes, your C-section rate goes down, your baby's APGAR scores go up, meaning your baby comes out healthier if you can exercise. So I have to play devil's advocate here in that I don't ever want to make a mom feel bad because she can't exercise, but at the same time, I want to talk you into exercising if I can.
Yeah.
So we're looking at 150 minutes a week of moderate intense exercise is what is recommended from the American College of Obstetrics for a pregnant woman. So 150 minutes, that can be broken up however you want. 2 of those days need to be strength training. There is nothing wrong with lifting weights. And honestly, Camp Gladiator weights aren't even real weights. Please do your dumbbells at Camp Gladiator. If you think about what's happening, you're gonna have a baby that's 8 pounds that then is in a carrier that's a 20-pound carrier that then has to go into a car. Like, think about the things that you're about to have to do immediately. And that you've got to prepare for that. And that we look at pregnancy as a time to kind of store up for winter, if you will, because immediately postpartum, you won't be doing those things. I won't be having you lifting weights, and that you are in a vulnerable time postpartum because you're healing. Right now, there is nothing wrong with lifting weights, nothing wrong with it. And if you go onto the American College of Obstetrics, they have a committee opinion that came out that completely, they said, hey, the heart rate thing is not real. So I don't want to like talk bad about your OB, but like that's really old school, old school. So they tell you, if anything, you want to be able to do what's called the talk test, in that when you work out, you should be able to talk to your neighbor, but not sing a song. So if Ruth Ann wanted me to sing to her, I couldn't be able to because I'm breathing that hard, right? Like you need to be huffing and puffing enough where singing isn't doable, but I could get some words out. But again, gasping for breath is not bad. So throw away your heart rate monitor. Again, you need to listen to your doctor. So don't listen to me. But if you wanted to go talk to your doctor, we're saying it. I'm a practitioner, but that is something that I would maybe take that to him and say, hey, I read this thing that American College of Obstetrics, your governing board says that heart rate isn't a thing. Why are you still telling me I need to be listening to my heart rate? So don't be scared about that. And in the end, I do, you know, you mentioned hiking. That was life-giving to you. That was therapeutic. I'd start there. Do that. Do what you enjoy. Yeah. Do what you're comfortable with, and get in and do that. That's hard. That's a hard thing to do. Go to Camp Gladiator. Our big thing that we just ask women to kind of not do, or what we want you to be mindful of, is leaking, pain, and pressure. If you leak, meaning if you pee in your pants, if you have vaginal pain or pelvic pain, or I get pain anywhere, or pressure in your vagina, those are those signs that what you're doing is inappropriate. And you need to kind of back off and regroup. And so that's really our kind of blanket statement to, as you're getting into exercise. But I would encourage you to do it. Your baby is going to benefit from it, and your rehab will, on paper, be much better. Women who exercise throughout their pregnancy do much better postpartum.
Okay.
Yeah.
Thank you.
Don't be scared. You can do it.
Okay. Even this late in the game, I can try and get back into it. Okay.
You know, it's funny. The committee opinion that came out said that women who have literally never exercised a day in their life are still recommended, no matter what time in pregnancy, to start, because the gains are so important. That what you get from exercise and what your baby gets far outweighs any risk that comes with exercise. And the risk that comes with it is like, you might roll your ankle. Like, it's musculoskeletal things to you. You will not hurt your baby. You know, again, this is all with the understanding that you have a healthy pregnancy and your OB checks off on it.
Yeah.
But there's far too much to gain from exercise. So if you can do it, do it.
Okay. Great. Thank you.
You got it. Congrats, by the way. That's awesome. I'm excited.
Thank you.
Yeah, for sure. What else? Any other questions?
Hey, I have a few questions. Can you guys hear me okay?
Yes, ma'am.
All right, fantastic. So sorry for joining late. I had to put the babies to bed. So I'm really excited to go back and to kind of listen to what you guys have talked about in the beginning, but what I've heard right now so far in the last half hours, really encouraging to go forward to find a physical therapist to really address the pelvic floor. I recently moved to New Jersey, or else I would just come to y'all down in Dallas. So whenever I'm looking for a physical therapist with that focus, what am I looking for? So doing a quick Google search, it's not really that clear how to find that.
That's a really good question. There are two databases, pelvicguru.com.
Okay.
If you can search by zip code and it will come up. It's not just pelvic health. It's just not therapists. Pelvic Guru is any pelvic health practitioner. So that could be OBs, it could be urogynes, but you can look for pelvic floor physical therapists. And then what is Herman Wallace's? If you Google Herman and Wallace, it's something very generic. It's like pelvicpain.com or something.
Okay.
Herman Wallace. I'll look it up here in a second and tell it to you. There's another one. It's a database.
Perfect.
And so you can search by zip code. When you call them though, it is, we're very big on your pelvic floor therapists. They need to be skilled and certified in doing internal exams.
Okay.
That's like an extra certification. There are a lot of people who say that they're pelvic floor specialists and they're not. So you can kind of say it. So I always ask, are you skilled or are you certified to do internal work? That doesn't mean you necessarily have to do it, but they know more than the person who doesn't.
Okay.
And then I just ask, what's your experience? Interview them. What kind of patients do you see? Do you work with postpartum women? How many do you work with, type thing, and just give them a little interview and see if they're comfortable doing it. But most of the time, if they're on that database, there's normally little bios that you can kind of see, what people's specialties are.
Great.
It's called pelvicrehab.com.
Yes, pelvic
rehab.
Literally, the first thing it'll pull up will just say zip code, or if you're trying to look for a specific provider, but you just put in your zip code and there will be a list of pelvic health specialists in your area.
Awesome. Fantastic. Thank you. And then, so I'm currently 11 weeks postpartum. Is it too late to start? No. Okay.
No. So not at all. It's never too late. Even if you're 10 years postpartum, it's not too late. I think going and getting an internal exam, I know sometimes that can be a little weird to think about. And what that is they examine your pelvic floor internally, vaginally. It is like the most, I don't know. I think you can glean so much information from it. And that, am I doing a Kegel correctly? 60% of women come in and are not doing a Kegel correctly. And are Kegels even appropriate for you? So much of the time people are like, oh, I do 1,000 Kegels a day. And I'm like, why are you doing that? And most of the time it's not about Kegels. It's about so much more than that. And so anyways, I'm big on it. I think it's just good information. Even if you have zero complaints, just what's the state of the union? Am I, and what are my opportunity areas over the next year? What can I do? And then what are your goals? Do I want to run a marathon by the end? Do I want to just be able to go and jump on a trampoline with my kids? What is it that I want to do? Right. And they should be able to kind of help guide you in that, to help kind of give you the confidence and the steps to get there.
Perfect. Great. Thank you. So before I can, really locate what that physical therapist looks like, I have been doing on the side. It's called the Every Mother app or program. Are you guys familiar? Do you like that?
I don't know it specifically. I know of it. I don't know. Do you know anything about
I've had a couple of clients actually recently that just came up. It seems like a good program. I think it's a lot like the kind of things we had talked about, in that there's a lot of good meat there of things to work on. Nobody, that program's not bringing out anything that's going to be totally contraindicated for you. So I think it's a good program to be following. It's just, it misses that piece of personality and just kind of teasing out what specific things you need to be working on. Right. But I have had moms who have come in, we're looking at them postpartum, like, well, I did Every Mother, and the information that we get to gather from our visit together makes those exercises feel and look different too. Like, oh, I didn't think about that. Or these are the things I need to think about when I do these movements.
Okay.
And so, yeah, great. It's a good program. I think that it's just, as you needing somebody, like just a resource in general as you're in transition of being in a new a new area, I think it's a great resource for you as you're kind of like riding the ship a little bit into recovery. But I would also very much encourage you to find somebody who's going to look at you and look at your pelvic floor and take the blanket statements out of it and be able to speak specifically to what you need and what your specific, deficits are, or we call them opportunity areas, if you will, for your recovery.
No, and I agree. And again, not to kind of bash the app itself. I mean, it's been eye-opening, but it's also, to your point, it's very vague. Whenever they say like inhale or like, clench, that doesn't mean anything. I have no idea if I'm doing the exercises properly. Yeah, so I agree. Okay. And then the last one, and so the painful sex, that was actually really surprising to me. I had a C-section, twins. I didn't think that was going to be an issue. It kind of caught me off guard. And so, I mean, I guess when I see the physical therapist, they'll be able to kind of address that. Can you kind of speak a little bit more about that and kind of like, what does that recovery or timeline look like to kind of get back to normal?
That's a really good question. I don't know that answer. I'm not gonna, everyone's so different. It is very common though. It is so very common post-cesarean to have pain with intercourse or any pain with penetration. So I just want to encourage you and know that you're not out of the ordinary, and that's not weird, and it's definitely not something that you need to live with or just drink to like become numb to it.
Right.
So, but very quickly, just like anatomically, what ends up happening is our core is this like orchestra that they kind of play off of each other, our pelvic floor and our abdomen. And if you think about what a cesarean is you go and cut that and they kind of bind it up. And we have a lot of weakness and a lack of stability. And so what ends up happening is our pelvic floor has to kind of gather up. It's trying to help.
Okay.
It's trying to help you find stability and help kind of stabilize your pelvis and your body. And so this pelvic floor that should be this, we always kind of say it should be like a trampoline. It should be this kind of ebbing and flowing all day long, gets up and stuck and very tensioned and tight. And so if you can imagine then a penis or a finger or a vibrator or whatever going in, and it's not going to feel good to something that all day long is clenched.
Gotcha.
That's
Okay.
a very small range of motion.
Yeah.
And so they're going to go in and talk to you. They should be able to talk about like unlocking that a little bit, and it's gaining strength in the front of your belly. So the stronger your belly can be, your pelvic floor can go, oh, I don't have to do this job anymore.
I see.
So there's a little bit of that slow, long game of just get strong, but there's also some very specific things that you can do immediately that a lot of the times people, especially post-cesarean, it normally can kind of resolve itself pretty quickly.
Okay.
So I wouldn't be worried about it, and that there is freedom in that for sure.
Perfect. Thank you. And I really look forward to going back and missing or hearing what I missed. So thank you guys.
Yeah, absolutely. It's great to talk to you.
And I would say too, find us on Instagram. We work very, very hard and diligently to make our social media something that is very educational, occasionally funny, but like we put a lot of work into that, just as not only to like, kind of let people know about us, but also as just as good information. And so finding us on Instagram is another helpful resource of things to think about. And we cover certain topics every week and try to put out as much helpful information as we can.
Yeah, that's awesome. Thank you.
Yeah.
How can people get a hold of you? So what is your Instagram handle? And if people do want to follow you there and reach out and things like that.
So our Instagram handle is just PeakRX, PeakRX. Literally, that's it. And we're also on Facebook, and then we also have like our own Instagrams too, where we kind of do our own flavor of things from the pelvic health and just physical therapy standpoint. So PeakRX is our main one. Go ahead and look there that's where you can find us best. And then we also have a website, just PeakRX.com. Right?
PeakRX
Therapy.com. I always forget the therapy.
There's not, yeah. Our Instagram is the best place to find us. And I'm pretty sure our individual ones are listed at the top, or I can go put that in now. But yeah, she's totally right. And we do almost diagnosis specific stuff each week. And so it's like, we want you to be able to scroll through and go, oh, pain with sex. Great. Let me click on that and maybe gain some information. So that's the point of it, or how we try to give it to you guys.
Awesome.
And we're very big too. It's us. We both access it. Like if you ever have any questions, like just send us a message on there. And then two, I also will help kind of out in New Jersey, like if you find somebody that you're interested in to go see, it's kind of a small circle of pelvic health specialists. And so a lot of times I know people. So if you ever have any questions, like we would love to help give you, help you vet people, or, give us, we can help kind of troubleshoot anything for you too. We would love
Oh,
to.
that's wonderful. That's fantastic. Thank you.
Yeah, absolutely.
Awesome. Those were great questions. Danielle, Michelle, thank you guys. Brooke, Ruth Ann, thank you guys so much. This was like such a wealth of knowledge. Like,
Thank you.
I really appreciate you guys taking the time to walk us through all of that, because to your point, it does feel like a black hole sometimes. So it's really helpful when you guys have done all of the background work and you're just kind of spoon feeding it to us, saying like, here's what we believe feels right, like pick and choose what feels right for you. So thank you guys so much. This is incredible. And I really am so grateful you guys jumped on here and provided us with all that information.
Yeah, absolutely. Thank you for having us.
Of course. All right. Well, thanks again. And thanks everyone for joining, and we'll be in touch.
Awesome.
Awesome. Bye, guys.
Thank
Bye.
you.
Bye.
Bye.